Director for the Effia-Kwesimintsim Municipal Assembly, Joyce Bejina, has disclosed that respiratory tract infections have overtaken malaria as the leading condition recorded at outpatient departments across health facilities in the municipality. Speaking to ChannelOne TV on the sidelines of the municipality's 2025 annual health performance review, she explained that the decline in malaria cases is the result of sustained hard work and the implementation of several interventions aimed at preventing and controlling the disease. Our Western Bureau Chief Effia-Kwesimintsim reports from Tract.
For decades, malaria dominated OPD cases in many metropolitan, municipal and district assemblies, posing significant challenges to health directorates, including Effia-Kwesimintsim. In 2024, for instance, several MMDAs recorded hundreds of malaria cases and related deaths, making it the most prevalent condition at health facilities. However, at the 2025 Annual Health Performance Review of the Effia-Kwesimintsim Municipality, the health director revealed that malaria no longer tops OPD cases, attributing the shift to intensify preventive measures and public health interventions.
For the year under review, we realized that the top 5 common conditions that come to our OPD, I think I mentioned them, upper respiratory tract infection. Then we also have malaria. By malaria, no, it used to be the first reason why people come. But these days, because of the intervention programs we are putting in place, we are at the elimination stage as a country. We've put in a lot of interventions. And those days, we used to manage malaria without necessarily testing. Once we are presenting the signs and symptoms, we go ahead and then we presume it's malaria and then we manage. But now, everybody who comes with signs of malaria, we test you to be sure that you actually have malaria before we treat. Long-lasting insecticide-treated nets are also distributed to every household for them to use to protect themselves from mosquito bites that transmit malaria. We also do spraying in the environment. These are all the interventions that have come together to help us reduce the burden of malaria, and now it is going down as a major cause of OPD attendance.
Madam Bejina further urged residents to continue adhering to preventive measures to sustain the gains made.
When we also look at the admissions, malaria, even though it is the second cause of OPD attendance, it's the top cause of admissions. The fortunate thing or the good thing is that we are able to treat them and they don't die. We haven't recorded any malaria death. And that is very important to note. So what we need to do is to sensitize our education on people reporting early when they start feeling signs of malaria or any other disease. When they come early, it means that it will not be severe malaria for them to go on admission. So when they come early, we are able to treat them at OPD and then we discharge them to.
Meanwhile, the physician assistant at Anaji Health Center, Patience Odro, has called for the urgent expansion of the facility and installation of an air conditioner in the pharmacy to improve service delivery.
We don't have a place for detention, so we don't have separate male ward, we don't have separate female ward. The only room that we have available is the one we use for both, and it's the same place that we use as our treatment area. So we need infrastructure, which is expansion. We also need air conditioning for our pharmacy store. Currently, we don't have air conditioning. So drugs that are heat sensitive, drugs that are light sensitive are being affected. Sometimes you go and pick the medicine and it's almost spoiled. You can't use it for the patient. So if we can get an air conditioning for that place, it will really go a long way to help us so that I can get quality drugs for our patients.
For ChannelOne TV News, I'm Effia-Kwesimintsim.